Hello, I'm Dr. Wanda Torres, MD. I am the founder of Suncoast Women's Care, a medical facility renowned for our expertise in women's reproductive health, obstetrics, minimally invasive surgery, and robotic assisted surgery. Join me each week as I interview guests in the top of their fields about the world of OBGYN, exploring the innovations and personal stories that shape our medical experiences.
Welcome to Suncoast Women's Care podcast, for lack of a better name. But this is an opportunity for us to really, reach out to the public, reach out to our patients on who we are. My name's Javier, and I'm the business manager of Suncoast Women's Care. It is an all-female practice. I'm really just the support staff. I just deal with the marketing of the practice. And I'm going to introduce you to the founder, who also is my wife. I'm married to the boss, and she has been instrumental in building this practice since 2002. We'll go into that in a bit. And now we are 25 years later, into a practice with 3 offices covering basically the entire Tampa Bay market with 5+ providers, and continue to offer the services of OBGYN to our practice. So, Dr. Torres, you started this practice. You called it Suncoast Women's Care. Tell us how that began. What got you to start your own practice?
Well, so let me go a little bit back in time because I did graduate from OBGYN in 1998. And ever since I was a little girl, 4 years old, I told my pediatrician that I wanted to be a physician just like him. So, of course, let's fast forward. I do well in school, in grade school, high school, and college, and I always wanted to be a physician, so I applied to medical school, and I did medical school through the University of Puerto Rico, and did my OBGYN residency through the University District Hospital affiliated to the med school in Puerto Rico. Graduated in 98, and I always thought that I wanted to come and practice in Florida, have family in Florida, and of course, with my bilingual skills, I thought that I could help, uh, you know, Spanish-speaking patients here in Florida. I decided to open a practice once I was board certified in OBGYN, and started in 2002, not knowing the business side of medicine, just wanting to take care of my patients, and wanting to provide gentle and quality OBGYN care for women by women. So that's how it all started in April of 2002. I remember when I did not have any patients whatsoever, so I would go introduce myself to different primary care physicians in the area, and introduce myself at the hospital. And little by little, the consultations started happening. So for a few years, I was a solo practitioner on call 24/7. And once I started getting busier, I incorporated the services of a nurse midwife, which are, we work hand in hand, and we have a good collaboration with. And the practice just continued to grow. I have delivered many, many babies. And just recently, I delivered a baby of a baby. which makes me a grandma OB.
The baby OB, right? Baby OB. That's the milestone you always told
That
me.
was, in my career now that, I'm almost 25 years into practicing after graduation for residency. I had several milestones that I wanted to accomplish, and that was one of them. I really wanted to deliver a baby of a baby that I had delivered. So,
And you mentioned earlier, taking the chance because starting your own practice wasn't your initial idea. You wanted to just, practice medicine and you worked for different doctors, but you realized to have more ownership and control the direction you wanted to, you needed to really kind of be on your own. And you were
uh,
fortunate to have some people like the CPA and that person introduced you to the right people to get the business part of it. You were lucky to have some people that were good
that were
partners
that were instrumental in guiding me in how to open a practice and how to manage a practice. Um, I've always had the approach because, yes, I did work for other physicians before deciding to open a practice, and I just wanted to do it differently. I wanted to be able to offer the patients my time, be able to talk to the patients and not be on a timer, so that I was able to talk to the patients. That's how I think we do it differently at Suncoast Women's Care. We just listen to you. We sit down with you and we have a conversation with our patients. And I think that's why we have been able to grow the practice.
and your mission, the mission statement you've always had that we mention to our staff when we have meetings is Sunco Women's Care to provide gentle and comprehensive OBGYN care for women by women. And that
And
kind of
quality OBGYN
quality
care.
OBGYN care, comprehensive OBGYN care for women by women. And that's really the essence of the of what you have started and we continue to that philosophy that you're there and it's female professionals working with female patients and truly understanding where they're coming from.
Hmm.
Yeah.
So, yes, I started with a little office, which initially it was just a front staff person, which acted as a front staff and medical assistant, and myself.
Mm-hmm.
And she would check in, bring the patients, and I would check them out. And we used to do everything in the practice. And it was interesting how it started growing and growing, which I didn't know. I didn't know that it was going to go there. I didn't know that it was going to be successful, but I was going to give it my all and take care of the patients.
Well, like any business, the certain things organically happen, or and granted, you have a vision of what you want to do. You and I met a couple
Hmm.
years into your practice, and I ended up, being part of some customer care behind the scenes,
Hmm.
dealing with all the things operational to deal with.
Yeah,
Yeah.
things that I did not have time to
Yeah.
take care of, and I didn't. Since I was delivering babies and doing the surgeries, and I did not
But,
have
but
time.
but you got your own marketing savvy because you found an artist and you had a vision and you carry it with this wonderful logo that kind of signifies what Suncoast is. And if anybody sees it, they'll see the mom holding the baby and that's a
Yeah.
big part of what Suncoast is about.
Yeah, that vision, I just was able to express it to the artist of what I wanted in my logo, and I wanted to incorporate a mom holding a baby and being connected via the umbilical cord, and the
Oh, they did.
artist was able to
They
see
did.
my vision,
Yeah, they did a great job.
and they did a fantastic job with that.
And,
So,
yeah, and like any practice, you know, you can only grow so much by yourself. You need to bring in other people. And over time, you and I, we've had our ups and downs with the practice, but we were able to find good people. We have a great practice manager who now runs the 3 offices. We eventually, like a lot of, in healthcare, if anybody knows anybody in healthcare, they've had to either grow or join other specialists together. And we became part of a OBGYN group that's one of the largest in the country. And that helped us because they gave us resources and tools, from health benefits to our employees, to just other tools that we could able to grow. And because of that, we now have an office in West Chase, and we also have an office in Safety Harbor, Clearwater area.
At the East Countryside campus,
Yes.
and then we have our where everything started, the Trinity office. We have in total 4 full-time OBGYNs, one nurse
Physicians.
midwife, and myself, which I currently am doing GYN only after 25 years of delivering babies. And I did a lot of call 24/7 solo. So I have come to the 25-year mark where I decided to do GYN only. But it's very satisfying when I see babies that now are adults and are coming to the practice for us to take care of them during their pregnancy. And it has been a full circle, this whole experience. And I do enjoy doing surgical procedures. I have done 400 plus robotic surgeries. I do enjoy doing in office surgeries. And I love to mentor. I love to mentor our younger physicians, and I love to mentor medical students. So I think, again, this whole practice and this whole medical career has come full circle for me.
Well, we got many more years for our pride to continue growing, and we have a lot of wonderful things in the future that's going to be available. And this whole project here is to connect and educate the public and our patients and those that want to know more about us. So we hope that you guys get to learn more about who Suncoast Women's Care is.
Mm-hmm.
Well, again, Dr. Torres, wifey, boss, thank you. I know this is not your comfort zone, but you're doing a great job, and I thank you for being part of this podcast project that we're doing.
Well, and thank you, Javier, for number one, being an excellent husband. Thank you for being
Hey.
so supportive of Suncoast Women's Care throughout the years. It has not been an easy project. It has been a lot of ups and downs, like anything.
Well,
But now we are seeing the growth of this practice and the success of the practice. So thank you for that.
yeah, and not you brought something up that I didn't even think about. We talk about our patients and our providers, but really our practice has grown not only because of that, but because we have a great team of employees.
We have
We have a phenomenal
wonderful,
team of
wonderful
employees.
employees.
And our philosophy is because that mission statement, providing gentle care, and comprehensive to our patients, for women, by women, it also extends to our staff. Respect to our providers, our vendors, our employees, because they also, are part of this, and we wouldn't be growing the way we are if we didn't have those great relationships with our employees and even with our outside vendors as well. So that's important. So thank you.